Okay, guys, so in this video, we are moving on from the axial skeleton to the appendicular skeleton. So remember, just a real quick review, axial skeleton is our midline structures, right? So the head, thoracic cavity, and then the spinal cord. So that's the front anterior view, and here's the posterior view. And then the appendicular skeleton is everything else outside of that. So the pectoral girdle, shoulder girdle, the upper extremities, the pelvic girdle or the pelvis, and then the lower extremities, right? So we'll back our skeleton up and then come on up and pull up our slick handy dandy anatomy app and get right into looking at it. And we're going to start we're actually going to start on the lower half of the body at the pelvic girdle and look at the lower extremities. And then we'll go to the shoulder girdle and to the upper extremities. So let's move this over here so you guys can see better. The function of the appendicular skeleton is to create movement of the body. Not that the axial skeleton doesn't have movement, because we talked about that, right? Because spine has movement to it, but really this is how we move our limbs, our upper extremities and our lower extremities, and how they connect into the axial skeleton. So starting here in the pelvic girdle, or what we commonly know as the hip bones, for the pelvis, we'll look at the hip bone first. So the hip bone is actually a combination of three different bones that are put together. So that's the posterior version of it. This is the lateral view. And then here we have the anterior view, right? And so you can see it's this flat bone up here. There's this curvature down here. And then we have this section back here. So we'll take a look at that in our a photo that's a little bit larger that highlights in different colors for you. So this is what we call this upper portion here. It's called the ilium. The bottom portion that's to the posterior aspect is called the ischium. And then the front portion, so that piece of bone that's towards the anterior version, is called the pubis. And I am going to bring this guy up for us a little bit, just so we can see on the skeleton here. So there we go. So here, this is the ilium, this flat part up here. So this is the anterior portion of it. And then this is the posterior portion. And then we want to look at the ischium. So that is this back portion here. So this round portion you can kind of see at this angle here, this lower portion. And then the front, you come back to the front, and then this here, this section of bone here is called the pubis bone. Now, you're probably more familiar than you think with one of these three bones, which is the ischium. So this back portion here, these two on either side, the left and the right, are what we often refer to as, there's a landmark here at the bottom called the ischial tuberosity. And that's commonly referred to the sit bones, because when we sit down, that's what we sit onto, as the ischial tuberosities. So that's part of the ischium. And then the upper portion here, so the ilium, there's a couple of landmarks I want you guys to know. And there's some diagrams in your handouts that are color-coded and have these written on them, but it's nice to see it up close and towards the skeleton. So you can see here, what we talk about, and it can be a nice reference point, is the upper portion or the upper crest of the hip. And this is known as the iliac crest. So you can palpate that on yourself. So if you stand up or if you're sitting down and you come to find the edge of your top of your hip and kind of dig in a little bit, you'll feel what we call the iliac crest. And that can be good reference point for people. That's the top portion of the hip. And then we have some other portions that you don't necessarily need to know, but the longer you stay in teaching, you might come to reference these. So this bony portion here, right here at the front, right? This guy coming down here, this is called the anterior superior iliac spine. And it's commonly abbreviated as the ASIS. And so you can feel your ASIS on yourself. You'll take your hands, bring them to the top of the iliac crest, and then take your index finger and just come down until you start to feel that first bony point. It's a little hard to see here, but we can do it when we're all together. And you can feel your ASIS. And then if there's an anterior superior iliac spine, then there are reasons to be that there's probably a posterior, and you would be right. So the posterior, it's called the PSIS. So it's this bony prominence at the very back portion of the ilium. And you can feel your PSIS too. You just sort of come down, find the top of the hips on the back, and then come down, and you'll find there's sort of a little notch that's there. And then that notch, just below that notch, you can start to, this guy's pelvis is kind of super tilted, so it's hard to see. You can feel actually the sacroiliac joint, the SI joint, is just down and sort of below that. So those are important landmarks. And then the other landmark that you'll want to know, and we'll pull up a picture of that a little bit better, but is the inside of the hip bone here. Well, sorry, it's the medial aspect of the hip bone where this indentation is, where the femur, the head of the femur goes. That's called the acetabulum. And let me get a picture here for you. Let's put the skeleton back there. And you can see what that looks like. So here is a diagram of the acetabulum. So you can see here, this is the medial aspect of the hip bone. This indentation is called the acetabulum. And then the femoral head of the femur, the long bone of the upper leg, that the femoral head fits into the acetabulum. And so this joint is actually called the acetabulo-femoral joint, acetabulo-femoral joint. It's a really long joint. We just often refer to it as the hip joint. So you want to be familiar with that. And then you can just real quick here, we can just look at those landmarks again. So here's the iliac crest, the top portion of the hip. Here's that ASIS, that first bony portion. Here's the ischial tuberosity. So this is the ischium. And then right at the bottom is the tuberosity. We recorded that as the sit bone. And then here's the posterior aspect. So here's what we label as the PSIS. And then you can see in here is the sacroiliac joint. Oops. Good. So now we'll move down to, real quick, we want to look at this other major joint. So the we've already talked about the sacroiliac joint is one of the major joints, as well as the acetabulo-femoral. I don't know why I can't say that, but you know what I'm meaning. The hip joint. And then there's something called the pubis symphysis. Probably struggling with my words today, aren't I? And that is the joint that joins the two sides of the hips together right here in the center. This is this nice little triangular space. And I can bring our skeleton up for us here too. Let me give you another photo of it. This is a side view. Here's the pubis symphysis. And then here's also that acetabulofemoral joint. So this is the joint with the joint capsule on it. And you can see all the layers. These little things are called fat pads and bursa. They're additional connective tissue to help protect it.